The crushing weight of care: understanding burnout in nursing and midwifery. Nurses and midwives are the backbone of healthcare. They provide care, comfort, and support to patients during some of the most vulnerable moments of their lives. However, the demanding nature of these professions often comes at a cost. Burnout, a state of emotional, physical, and mental exhaustion caused by prolonged exposure to overwhelming stressors, is a pervasive issue among nurses and midwives. Recognizing and addressing burnout is not just about improving working conditions, it is about ensuring the well-being of those who dedicate their lives to caring for others. When healthcare professionals are burnt out, it impacts not only their own health and well-being, but also the quality of care they can provide. This essay will delve into the causes and consequences of burnout among nurses and midwives, bringing to light the often unseen struggles they face. By understanding the factors that contribute to burnout, we can work towards creating healthier and more supportive work environments that prioritize the well-being of these essential healthcare professionals. Under pressure: long hours, emotional strain, and lack of support. The roots of burnout within nursing and midwifery run deep, often stemming from systemic issues within the healthcare industry itself. Long hours, often exceeding 12-hour shifts, are commonplace, leaving nurses and midwives physically and emotionally drained. Beyond the physical demands, the emotional toll of these professions is immense. Nurses and midwives witness suffering, grief, and loss daily. They provide emotional support to patients and their families, often carrying the weight of these experiences home with them. This emotional labor, while invaluable, can lead to compassion fatigue and burnout if not adequately addressed. Adding to the burden is the frequent lack of support within the workplace. Understaffing, high patient loads, and limited resources create an environment where nurses and midwives feel overwhelmed and undervalued. This lack of support can exacerbate stress levels and contribute to feelings of isolation and burnout. The price of compassion. Fatigue. Consequences of burnout. The consequences of burnout extend far beyond the individual nurse or midwife, impacting the entire healthcare system. When healthcare professionals are burnt out, the quality of care they provide can suffer. This can manifest as decreased patient satisfaction, increased medical errors, and a decline in overall patient safety. Burnout also takes a significant toll on the mental and physical health of nurses and midwives. Depression, anxiety, insomnia, and substance abuse are common among healthcare professionals struggling with burnout. The constant exposure to stress and trauma can lead to secondary traumatic stress, a condition similar to post-traumatic stress disorder, or PTSD. Furthermore, burnout contributes to high turnover rates within nursing and midwifery. When working conditions become unbearable, many healthcare professionals are forced to leave their jobs to prioritize their well-being. This leads to staffing shortages, further increasing the workload and stress on remaining staff, creating a vicious cycle of burnout. A call for change: supporting the well-being of our healthcare heroes. Addressing the burnout crisis in nursing and midwifery requires a multifaceted approach. Healthcare institutions must prioritize creating supportive work environments that value the well-being of their staff. This includes addressing issues such as understaffing, providing adequate resources, and fostering a culture of respect and appreciation for nurses and midwives. Implementing strategies to promote work-life balance, such as flexible scheduling and adequate time off, is crucial. Encouraging nurses and midwives to utilize vacation time and disconnect from work while off-duty can help prevent burnout. Additionally, providing access to mental health resources such as counseling and support groups, specifically tailored to the needs of healthcare professionals, is essential. Policymakers also have a role to play in addressing this crisis. Implementing safe staffing ratios, enacting legislation that limits mandatory overtime, and providing financial incentives to attract and retain nurses and midwives can all contribute to creating a more sustainable and supportive healthcare workforce.